Disease. Students, now let us understand the real meaning of disease. The word disease means dis-ease or not at ease or departure from health. Disease is a condition of the body in which the vital functions are disturbed physiologically or psychologically. Specific symptoms and signs are associated with each disease. The point of entry of the pathogen and its target tissue in the body may not be the same. For example, the hepatitis virus enters through the mouth and produces disease in the liver. Poliovirus enters through the mouth and affects the nervous system. Symptoms and signs of diseases. Symptoms of the disease are the changes in the body that makes one feel sick or unwell. It is a feeling which is noticed by the patient, indicating the presence of a disease or abnormality. It does not pinpoint what the disease is. For example, headache may mean examination stress. An eye defect or a tumor is a symptom of many other diseases. Symptoms cannot be verified or measured. They are subjective to a particular patient. For example, aches and pain, itching, cough, cold, etc. Signs of a disease are what the medical practitioners look for on the basis of the symptoms. Signs give definite indication or inference of the presence of a particular disease. The symptoms of different diseases may be the same, but signs of different diseases are different. Signs of a disease can be verified or measured by a doctor, hence they are objective. For example, blood pressure, pulse rate, etc. The doctor will not diagnose a disease on the basis of just what you say, but will ask various probing questions. If you do not give all the symptoms along with the history, then the doctor will diagnose on the basis of insufficient information. The symptoms depend upon the target of the pathogens in the human body. For example, when liver is the target, there is jaundice. When lungs are the target, the symptoms are cough and breathlessness. In addition to these tissue-specific effects, there can be other common effects or symptoms. Some of the effects are due to the body's immune system, which fights off the disease-producing microbes. Because of infection, immune system is activated and sends many soldier cells to the affected tissue to kill the microbes. This causes inflammation, which leads to local effects like swelling and pain, and general effects such as fever. To confirm the disease, doctors then carry out confirmatory tests like laboratory tests of blood, urine, stool, or even X-ray. The severity of symptoms depends upon the number of disease-producing germs present in the body. If the disease-producing microbes are less, the disease manifestation is minor. That is, the symptoms are so less that they may even go unnoticed. Inflammation or edema. When tissues get damaged due to infection, chemicals such as histamine come out from them. These chemicals attract blood, due to which amount of blood supply and temperature of the wounded area increases. Plasma and WBCs are also discharged at the affected site. Thus, edema is produced locally. The plasma contains products that kill the organisms or inhibit their growth, antibodies, and macrophages. They combat the microorganisms. Macrophages and some WBCs secrete a chemical called interferon, which makes the body cells resistant to infections by viruses. Can you think of a reason for getting a small bump at the site of a mosquito bite or an insect bite? Students, now let us see the classification of diseases. Types of diseases. Diseases can be broadly classified in two different ways. Types based on the time for which the disease lasts and types based on the cause of disease. Under types of diseases based on the time for which the disease lasts, we have chronic and acute diseases. Let us learn more about these types of diseases. A. Chronic disease. Disease that lasts for a long time, sometimes even for a lifetime, is called a chronic disease. For example, diabetes and tuberculosis. B. Acute disease. Disease that lasts for a shorter duration is an acute disease. As it gets cured fast, it does not get time to cause major damage to the general health of the person. For example, common cold. Students, now let us see few important terms related to diseases. Endemic. Disease is found in a certain area attacking fewer people. For example, filariasis is endemic in the 3 districts of Kerala, namely Kottayam, Alappuzha and Ernakulam. Epidemic. Disease spreads from place to place, affecting large number of people. For example, typhoid epidemic can spread during a pilgrimage. Pandemic. Disease spreads worldwide. For example, AIDS. Types based on the cause of disease. A. Disease caused due to infectious agent or pathogen is called communicable or infectious disease. They are caused due to microbes like bacteria, fungi, virus, protozoa or helminthes, etc. These diseases spread quickly and widely where good community health is not maintained. For example, influenza, amoebic dysentery, etc. B. Disease which is caused due to internal non-infectious reason is called non-communicable or non-infectious disease. Such a disease is restricted to the person who is affected. For example, genetic abnormalities, wearing out of tissues such as arthritis, or deficiency diseases such as night blindness and degenerative diseases. Stephen William Hawking is a well-known British theoretical physicist. His work on black holes, theoretical cosmology, and quantum gravity is appreciated all over the world. In his late 20s, he started developing symptoms of amyotrophic lateral sclerosis, a kind of neuromuscular dystrophy which almost completely paralyzed him. He went on to complete his doctorate in the same condition. In 1985, he caught pneumonia and underwent tracheotomy, which made him unable to speak. A Cambridge scientist built a device that enables him to write onto a computer with small movements of his body and then have a voice synthesizer speak what he has typed. Using that, he has kept on with his work. Levels of cause of a disease. Though we know that infectious diseases are caused by pathogens, there are various other factors which contribute to the contraction of a disease. Diseases generally have more than one cause. There is an immediate cause and other contributory causes. Means of spread of a disease. An infectious disease spreads through air, water, and food, or by vectors such as insects and animals, and through sexual contact. Diseases that are transmitted through air spread easily. This occurs through the little droplets expelled by an infected person who sneezes or coughs. Someone standing nearby can breathe in these droplets and the microbes get an entry into his or her body. Examples of such airborne diseases are tuberculosis, pneumonia, swine flu, etc. Air-transmitted diseases are easier to catch the closer we are to the infected person. However, in closed areas, the droplet nuclei recirculate and pose a risk to everybody. Overcrowded and poorly ventilated housing is therefore a major factor in the spread of airborne disease. We live in an environment along with other living beings apart from us. It is inevitable that many diseases will be transmitted to us by them. These animals are thus the intermediaries and are called vectors. The most common vector we all know is the mosquito. The female Anopheles mosquito needs nutritious food in the form of blood in order to lay eggs. While sucking the blood, they infect the person with germs present in their body, thus spreading malaria in healthy humans. Prevention of infectious diseases. You have already seen that personal health depends on public and community health. Microorganisms spread quickly and widely where good community health is not maintained. Prevention of a disease includes activities designed to protect members of the public from actual or potential health threats and their harmful consequences. How can you prevent an infectious disease? Prevention of disease follows three basic principles. 1. Keeping out the infectious agents, that is, maintain public and personal hygiene. 2. Availability of proper and sufficient food and water for everyone. 3. Immunization. An organism has the ability to resist disease or stop its progress. This ability is called immunity. Immunity is also defined as the resistance to the onset of a disease after infection by harmful germs. Immunization is the process by which an individual's immune system gets equipped to fight off an infectious agent. Active immunity is produced by vaccination. Immunization against some common diseases has been taken up in India on a large scale by giving vaccines against them. For example, BCG vaccine, DPT vaccine, polio vaccine.